well, like Taiwan, who's only had, I think, a total of 30 cases or something, despite being just 80 miles off the coast. Singapore, South Korea got hit hard, but did all the right things and brought it under control. In contrast, Italy, it wasn't that they were ignoring it. They just said, well, let's wait and see. And as they waited, the epidemic exploded. I'm afraid we're much more like Italy right now than we are like Korea or Taiwan or Singapore. We are not doing a very good job taking this seriously. The virus is extremely contagious, more so than I think any of us thought to begin with. It doesn't take much exposure to pick it up, and people do shed the virus before they start having symptoms. And so it's possible that you could come into contact with somebody who looks completely well and they don't know that they have it, and you've picked it up from them. The other concept of this is that once people get infected, the course is variable, highly variable. In my case, I just felt kind of puny for a couple hours one day and then started getting a headache and a runny nose and then a cough, and the cough seems to be persistent. The biggest misconception I'm seeing out there is that people say fever. Fever is the main thing. No, fever doesn't occur in everyone, number one. And number two, it's a late symptom in a lot of people. And for my case, I got infected probably Thursday night, started getting symptoms on Saturday. I didn't start developing fever really until Wednesday night. Ironically, after I thought I'd already kicked it. So this thing is relentless and it comes and goes and it's miserable. Um, the other part of this that I think I'd call the horror of it is that no one knows who's going to progress to needing hospitalization or worse, a ventilator. It's unpredictable. You start feeling, this person feels sick, and then they start having a little bit of trouble breathing, and they can go rapidly into respiratory failure within less than an hour and need a ventilator. This is part of the story of the infection. Another total misconception is that, oh, it only affects the elderly. Wrong. There are people dying in their 30s and 40s, cardiologists, an anesthesiologist. I mean, there are people all over the country, much less the world, who are in big trouble because of this. It's happening in New Orleans right now. So if you're young and you think you're immune or you aren't immune, but you're not going to get infected, wrong. You can get infected and you can get very sick. So this is something that affects all of us. When you put that together, then you start hearing about the social isolation and social distancing. Um, Basically, I don't have to repeat that for you, I don't think. You know, the hand washing for 20 minutes, the wiping down surfaces, not touching your face. That's not sufficient. I mean, I was doing that and I got infected. So what's the only thing we can do? Stay at home. Stay at home. Leave only if it's essential. That's the lens. Focus everything through that lens of, is it essential? Is it essential that I go get my hair done? No. Is it essential that I go work out at the gym? No, not essential. Is it essential for me to um, go to some friend's house and play cards? Absolutely not. That's not essential. Get groceries? Yes. Medicines? Yes. If you work for the healthcare system or the fire department, sanitation, uh, uh, for the police department, yes, that's essential. But everything else should be shut down. That includes retail, that includes anything where people can congregate, including our synagogues. So, fortunately, the rabbis in the community, this was over a week and a half ago, I was in close communication. And while there was initially not really pushback, just questioning why we should do that, this is before I became infected, they embraced that and push forward. And I think the community, for the most part, has been supportive. But this is something that is exploding in a way that we've never had this type of experience before. There's never been a pandemic in our lifetime. The last one was really the 1918 Spanish flu epidemic, and it's a whole different society now. But the concepts are still the same. This is something you don't want to get. This is something you want to protect yourself against. And you need to do all the things that you can to make sure that you're safe. Um, what do you do if somebody catches it in your home? Well, the first thing you do is you quarantine the person who's infected. This is me in my Riker Island jail cell. I've been here since Friday night a week ago. I stay in this room for 23 and 3/4 hours a day. Every now and then I walk out, drop some trash, and then come back into my module, as they say. Harry's been downstairs in the basement. He's well now. I think he's well enough to where um, he's probably not shedding virus anymore. So I think it's safe for him to move about the house. Amy, fortunately, has been fairly well protected, although we don't know. Like I said, this thing is so contagious. It's kind of hard for me to imagine living in an environment with anyone who has this and not picking it up. So again, the number one thing you want to do is protect against anyone in your family getting infected. And then once someone does, just do everything you can to prevent the spread. I will add a couple of other things. Because it is so hard in the environment of a home, other countries like Korea and China, what they did is somebody tested positive. They pulled that person out of their home environment and put them in, I don't want to call it a warehouse, but they put them in a facility where only other people with COVID-19 were until they got well. So they did not allow mix of people who were infected versus those who were not infected. And so that's a key thing of what really works. Couple questions. Okay, you're going to say, well, how long do we need to hunker down on this stay at home? I don't know. I'm guessing it's going to be more than 2 weeks, let me tell you. It's going to be at least 4 weeks. I would be surprised if we're relaxing this by mid-May or early June, if we're going to do it right. And you say, well, why do you want to be so aggressive? The best line I can think of is that anything that's done before a pandemic hit is called an overreaction. Anything that in retrospect was done after the pandemic's gone through is a why didn't we do more? The time is now. New York is a little bit too late, maybe more than a little bit. San Francisco, California, and other places there, maybe they got out in front. We in Birmingham are out in front of it right now. I believe Mayor Woodfin released an order for stay at home last night. If not, I'm sure he's going to do it today. That's the right thing to do. And when it gets released, the other question is, will it come back? I don't know. China's been relaxing things, and there doesn't seem to be a new surge in cases, but that remains to be seen. The other reason to have this relatively aggressive stance from a public health department or public health standpoint is that if all the people get infected at once, you get this so-called surge. And in the newspaper article I wrote about a week ago, you can see what the surge does. It overwhelms the healthcare system. And it's the estimates, if we did nothing, was that around 70 million to 120 million people in the United States would become infected with COVID. And if all those people became infected at once, there's no way that the healthcare system could absorb that. What that means is that not only are people with COVID not being able to get into the hospital when they need it, or they can't get in an ICU or on a ventilator, everybody else who needs to be in the hospital for trauma, burns, a heart attack, you name it, all the things that usually take people to the hospital, won't be any beds. So this has secondary and tertiary derivatives that we can't comprehend because we've never been through it before. So it requires all of us to think beyond minor inconvenience of staying at home. My final comment is, and then I'll take questions, is that I liken this to 1940 London, when the Germans were blitz bombing the city. Churchill stood up and said, everyone stay at home, be calm, carry on, but stay at home, hunker down. They changed their way of life because they had to. They were being invaded. We're being invaded by a virus right now, and we can't finesse it. We can't dodge it. We can't give it euphemisms. That doesn't work. And the clarity we're getting from our local health department and from our mayor and our state health department is clear. And from a lot of the governors I've seen and other mayors, it's clear. The message I see coming out of Washington, especially at press conferences, to me is kind of muddied. I can't tell exactly what I'm being told. And so that's why it's important the grassroots level get organized and act. So again, I'm grateful for the opportunity to be with you, and I'm happy to take any questions.
Dr. Saag, thank you very much for that. I got a question emailed to me earlier today. If masks were available to the public, should we be wearing them, and would a mask help in curbing the spread of the virus?
No, the virus is not easily spread by aerosol. If somebody coughed in your face, yeah, but mostly it's spread by what's called droplet nuclei, which means when somebody coughs or sneezes, the droplets land on a surface. The virus can live on that surface for up to a week. So you go to the gas pump, you grab the handle, you could pick up the virus. And then you get in your car and you do like this, or you rub your eye. You could have just picked up COVID. You go to the grocery store, you get the cart railing, the handle could have COVID on it. So we need to preserve our masks as well for the people who are working in the healthcare field. The one time you do want to wear a mask is have someone if they're truly infected. And if they're going in the house, it might not be a bad idea to wear a mask if you're going out of the room, especially if active coughing or sneezing. And we do that at the hospital and the clinics. If we know somebody or suspect somebody has COVID-19, the first thing we do is put a mask on them. But that's where a mask is beneficial.
Next question. If I am isolated for 2+ weeks and my children and grandchildren are also isolated 2+ weeks, when can we see each other again?
It depends on what's happened in the 2.5 weeks. If they've been truly isolated and they're not showing any signs, then perhaps you could get back together. But much as this is horrible, I wouldn't hug or get close with anybody else right now, because children, this is kind of another one of the hidden horrors of this. Children do get infected. They turn out not to have symptoms, but they're still shedding. So your grandchild could look totally normal, but could be churning virus out. And if we get infected, parents or grandparents, we're not going to do so well with the infection like they did. So I'd err on the side of caution aggressively. It's going to take sacrifice, but hopefully we'll all live through it, and you'll be able to be with your grandkids in the not too distant future.
Next question. We have 2 kids, 2 and 4, and Sarah is 36 weeks pregnant. If one of us gets it, it's unlikely that we will be able to function well with one of us isolated. Should we try to isolate?
Just isolating because Sarah's pregnant, no. The good news, I guess this is good news, about pregnancy is that the disease doesn't seem to be worse among pregnant women versus those who are not pregnant. In fact, women tend to have a milder course of illness as a rule than men. I could go into details for why that is, but I'll spare you. But unlike influenza, for example, if a woman is pregnant and gets influenza in the 3rd trimester, she can get extremely ill and end up on a ventilator. That isn't so much the case with this. So I think if you all have been hunkering down, I think I just let things be status quo. The only time I'd isolate is obviously if somebody became infected.
When we get Amazon and other delivery boxes, what precautions should we take?
I'd probably just wipe it down a little bit before I opened it. I think it's pretty safe, but who knows? So if the delivery person was infected and they didn't know it, or they had some mild symptoms, they're touching the box, then you get it in your house. I'd just wipe it down with a Clorox wipe or that type of thing, and then wash my hands real well before and after I open the box.
Tomorrow there is a blood drive at the LJCC. Is this safe?
It's safe as long as people keep their distance. That again, it goes back to that filter. Is this essential? To me, essential means saving a life. So yes, if you're going to donate blood, we're going to have a blood shortage. So yeah, go donate, but keep a distance. And when you go in and out of the building, wipe your hands down before you go in. Wipe them down after you come into the building. Sit to yourself. Um, don't socialize if you can help it. This is really hard for people, but it's the way we can stay safe. And blood drives are essential, so I think that's fine.
Is it okay to social distance 6 feet away and walk with friends?
I think so. Walking is healthy. You're outside. You're not really in a confined space. Um, you want to double check that each person on the walk doesn't have any symptoms before you go. Everyone feels good. And then, yeah, I think walking 6 feet apart is a good idea. Some people take their dogs on a walk. That's fine. Um, yeah,
Do we have any idea if people had it, has any short-term or long-term immunity, and can we reinfect ourselves?
don't know.
Okay.
Best guess is that it does provide immunity. Most of the other coronaviruses do lead to long-term immunity in some kind of way. I'm kind of hopeful that's true because, after having gone through it, I don't want to go through it again. It doesn't mean I'm going to let my guard down. Doesn't mean I'm going to be cavalier and walk into a hospital room with no mask or gloves or gown. But I do feel like would be in a better position because I probably do have immunity.
I have asthma. Any special advice?
Just hunker down. Nothing you
Right.
can do. You want to try to prevent getting the infection.
With the data showing that viral shedding lasts for a median duration of 21 days and up to nearly 40 days in some patients, is there any consideration to extend the 14-day recommended quarantine for those exposed directly to those with the virus, especially in light of the fact that the asymptomatic carrier rate is approximately 50%, and that these people are likely to still shed the virus upon the 14-day completion of the 14-day quarantine?
Well, here's where we don't know all the answers, and I don't know where the data came from, but I'm not sure the asymptomatic carrier rates are as high as 50%. We can quibble over that. We could quibble over how long. Some of the studies are using what they do as a viral load assay. They look inside the nose, they do a swab, and they see present or absent. That doesn't mean it's infectious, right? So detecting RNA from a virus from a prior infection doesn't necessarily mean it's transmissible. So it really takes a more deeper study of likelihood of transmission. And the studies that I'm aware of that have looked at this, the 14 days seems to be a reasonable best guess, but it is a guess. So this is welcome everybody to the world of healthcare policy. This is where the balance has to be made between what's known in a rapidly emerging epidemic to what's practical and doable. And so that's where this balancing, that's why the rules have changed almost every other day, from going from just protect yourself, where gloves if you go out maybe, or wash your hands and all that, to now just hunkering down and staying at home, because what we did wasn't sufficient. But people didn't want to jump right to that measure right off the bat, because people would have thought, oh, this is overreaction. In fact, here's a scary statistic. Every day we delay doing something to prevent, from a public health perspective, from preventing transmission, like this order to stay at home. Every day we do nothing, there are 40% new infections transmitted in that 24-hour period. And the second thing that's shocking is that you see the cases today, those are cases that were probably transmitted 2 weeks ago. So if we waited for another couple of weeks to see the numbers go to some threshold, we've waited too long. So the time is now, especially in Birmingham, because you see what's happening in New York. They acted, and trust me, they are smart people up there. I've worked with their health department. I've worked with a lot of the policymakers there. They try to do it right, and they miss this.
There is a question, and I want to just get it out here real quick about whether the JCC is collecting PPE supplies for hospitals. That was brought up. The answer to that question is yes, for who asked that question. Next question. For the synagogues, there will be deaths which require funerals.
Yeah.
Any wisdom on limitations around funeral attendance? Is outdoor event any safer with distancing?
Yeah, you're that correct. To me, it's essential to go to a funeral if you're a close family member or a close friend. I would recommend graveside service. I would recommend, we come together there. We try to keep some degree of distance. Obviously, you really want to hug, you probably shouldn't. The obviously immediate family, it's a huge loss. I'm not going to get all draconian about it, but the funerals, in my opinion, should be graveside, and they should be quick, and they should do all the things we need to do, but the social distance as best we can should be maintained.
Okay. If we do get symptoms like cough, cold, and fever, what medicine should we take?
Don't know. I think there's all kinds of Tylenol for sure. That's pretty safe. There's controversy about the non-steroidals, about whether that can be worse. I'm not convinced. If the symptoms start getting really bad, especially quickly, I'd call your provider and see what they recommend. There are some drugs, as you've heard about in the news, that are readily available, that are common, been used for decades, that we might be able to use for this. It's not proven yet, but it's probably better than nothing. And I would reserve that after discussion with your provider.
Will the warm weather kill the virus?
Don't know. I don't think so. I just don't think so. Look at MERS. MERS happened in the Middle East. Look at this virus has gone through other parts of the world where temperatures are kind of high. Philippines and in some places in India. So I don't know.
How are the Birmingham hospitals doing as far as protective equipment, beds, ventilators, etc.?
Well, I haven't been in since I got back from New York, but I'm on an email chain from UAB, and they seem to be on top of it. There are, as you can imagine, new cases coming in every day. I will tell you that they're opening up a testing site at UAB on Monday, tomorrow. Don't go if you're not having symptoms. Probably best to go after talking to your provider. I think there's a number that you call in advance where you have your symptoms screened by the person, and then you get a pass or something to go to this thing. I'm not sure exactly how it's going to work. But anyway, the hospital, I can just speak for UAB, is doing okay so far. They're making a lot of big changes. And this includes how they're doing contingency plans for if there is a surge. This is something, again, nobody's ever had to do before.
By the way the virus presents itself, mutates fast, are they highly susceptible to recombination?
Maybe. To translate that question, most viruses replicate very fast. And in the course of replication, errors are made, and those errors give it, in their genetic material, those errors give it think of Darwin, give it either a growth advantage or disadvantage. And so part of the way that viruses escape from the immune system is by mutating. So it's possible that this virus originally came from a recombination of a couple different coronaviruses, maybe in a bat that got transmitted to a civet, who knows? But that's how zoonosis or animal kingdom pathogens get into humans and become infectious. That's what happened with HIV among chimps in Cameroon. So that's expected. I don't think anything's happening that fast with this that we can look for a different wave next year, but who knows?
What would be an important metric to follow before you would recommend the local population could go back out to normal activities? What about some number of days of 0 new cases plus 3 weeks? Would you apply such a metric for county, state, or US?
Um, yes. I mean, it's a great question. I think what we have to in our advantage is other countries who are ahead of us on this, like China and South Korea. We need to be smart. We need to watch the experience carefully. We're not the first, and we won't be the last to experience this. But I would say, again, my best guess is 8 weeks. Um, yeah.
Can you explain about drinking room temperature water or beverage about every 15 minutes? Is this true?
Room temperature water to.
So there's been, I've seen this as well, that there's been some things going around the internet telling people to drink room temperature water or a beverage every 15 minutes, you know, to clear yourself. Is there any truth to what that's going around with?
I can't. No, I've not heard that in the medical world, and I'm having trouble understanding why it would work. But as long as it doesn't hurt you, just be prepared to pee a lot.
If we are self-isolating for 2 weeks strictly, and we have to go to the doctor or pharmacy, do we have to start all over again on the 2 week schedule?
No, no, no. Here, let me be clear. There are two different types of stay-at-home things. The first is that someone's had a known exposure, and then we tell them to quarantine themselves and isolate for the 14 days. That's one thing. The thing is that all of us, regardless of whether we thought we had an exposure or not, should be quarantined more or less at home voluntarily, so that we just stay at home and only go out for essential things. So what we'll do is if you have an appointment you need to keep, then you, for medicine or go to the pharmacy, you go out, you do it, you come back, you be safe, right? And this is going to continue that sort of public health quarantine for everybody. That was a question about how long does it go? And the answer is no one knows yet. I'm guessing 6 weeks, 8 weeks. I don't know. But
Um,
yeah, so you don't have to reset the clock unless
uh,
you have an exposure.
we have 4 more questions, and the next one is CJFS has ceased all face-to-face services, and there are no identified needs among our clients now, but we know that that will change soon, especially for food and meds. If we are under a stay-at-home directive beyond delivery services, would you recommend the use of volunteers for delivery? Keep in mind, this would be for vulnerable populations who we want to protect.
I go back to the word essential, and I could argue that delivery of supplies and food to an elderly person who otherwise can't get it is essential for them to live. So yes, we do that. We take extraordinary precautions. We have the volunteers wear gloves um, and keep a social distance. Only drop off the materials. Do not have contact with the older person, except just to maybe wave at them and ask from a distance how they're doing. But it's got to, the essential things are essential, and that gives you, I think, the pass to bend the rule in that case.
Okay, I think this is the last question regarding the virus here. Is there any concern regarding the sensitivity of our testing? Though it is a PCR, which should be sensitive, we are currently only testing patients that have high suspicion for having the virus. That said, in Alabama, as of this morning, 138 out of 1602, meaning 8% of the population we have tested has had a positive result. With such rigid standards for testing, wouldn't you expect this percentage to be higher? And to add to that, are there any concerns drive-through testing will lead to a sense of false security and reckless non-compliance for social distancing? A negative test today doesn't mean you can't catch the virus next week if you go back to your regular routine.
Correct. That's very accurate. I'll embellish that in two ways. One, early on, let's say 4 days, somebody gets infected here on day 0, 2 days, 3 days later, they know they had an exposure, they're worried, they get tested, they're negative. But then 4 days after that, they start having symptoms and they've got the disease and they probably would be positive. So the timing is everything on that. So it's possible somebody can be tested and not show up. Here's the thing I worry more about, though. Having had the test, if this test is done properly, it hurts like hell. I mean, it really hurts. They put a nasal swab in. It's got to go past what's called the turbinates and go all the way back to the pharynx. When you get back there, when the swab gets back there, they twirl it. You think somebody is burning. You have a burn going on inside your nose, and they've got to do that for 5 to 10 seconds to get a good sample. I've heard anecdotally from people who've gone in to get tested, especially at the drive-through place, that the technician will put the swab in and say, this will hurt. As soon as a person says, ouch, they pull the swab out. Well, maybe they didn't get the right specimen. So I think some of the reason, not maybe a lot, but some of the reason could well be that the specimen wasn't collected in an optimal way. And that's harmful for all the reasons that are alluded to, that it creates a false sense of, well, I'm okay, when the person may not be. So I've talked to the health department about this. They're redoubling their efforts in training people who do specimen collection, and hopefully that'll work itself out.
I guess there's one line. This is the final question that I'm going to read. Is there an explanation for the differences in mortality rate between different nations? For example, in Israel, there are approximately 1,000 citizens diagnosed with SARS-CoV-2 with 1 death, 0.1%, while Italy has a mortality rate which is nearly 10%.
Don't know. I just don't know.
Dr. Saag, I want to thank you very much for taking time out today to do this community call. On behalf of the members joining the call and the Birmingham Jewish Federation, we appreciate everything that you continue to do and the education you continue to provide for all of us, and we wish you a speedy recovery.
Thank you very much. Thanks, Danny, for organizing it.
Thank you all. Y'all have a good day.
Okay, bye-bye.